This lecture will go through the trigeminal nerve, or cranial nerve 5. The trigeminal nerve, or cranial nerve 5, is primarily a sensory nerve and provides sensation to the face, but also has motor components to the muscles of mastication, anterior belly of digastric, mylohyoid, tensor tympani, and tensor verli palatini. It exits the pons here, laterally in the body of the middle cerebellar peduncle and runs anterolaterally over the petrous ridge of the temporal bone, after which is located the trigeminal ganglion, within the trigeminal impression on the temporal bone or Meckel's cave. The sensory root of trigeminal forms three branches: the ophthalmic, maxillary, and mandibular branches. The motor fibers run in a small motor root and are not part of the sensory root. We'll begin with the ophthalmic division. Before exiting the skull, the ophthalmic division sends a branch backwards known as the tentorial branch, which supplies general sensation from portions of the tentorium cerebelli and the falx cerebri. It then exits the skull through the superior orbital fissure to supply most of the orbit and the forehead region above the eyes. We'll look at it from this side. After it exits the superior orbital fissure, it gives off three branches: the nasociliary nerve, the frontal nerve, and the lacrimal nerve. We'll begin with the lacrimal nerve since it has the least branches. The lacrimal nerve supplies general sensation from the lacrimal gland, skin, and conjunctiva of the upper eyelid and lateral eye. It gives off this branch, the palpable branch of lacrimal nerve, which supplies general sensation from the skin of the upper lateral eyelid. The frontal nerve from the ophthalmic division runs from the superior orbital fissure along the superior surface of the levator palpebrae superioris muscle. It gives up two branches: the supraorbital nerve, which runs through the supraorbital foramen, which is here, and gives off two more branches: the medial and lateral branches. These both serve to supply sensation from the forehead, frontal sinus, skin of the upper eyelid, and conjunctiva. The second nerve from the frontal nerve is this: the supratrochlear nerve, which exits the orbit along the supramedial margin, just here. It conveys general sensation from the forehead, glabella, frontal sinus, skin of the upper eyelid, and conjunctiva, and runs all the way back to here. The final division of the ophthalmic nerve is the nasociliary nerve. The nasociliary nerve conveys sensation from the skin of the dorsum of the nose and medial eyelids, the medial conjunctiva, the membranes of the ethmoidal air cells and sphenoid sinus, and portions of the nasal cavity. It first gives off a branch to the ciliary ganglion, which is just here. The ciliary ganglion receives preganglionic parasympathetic fibers from the oculomotor nerve, or cranial nerve 3. The postganglionic fibers leaving the otic ganglion also join up with the short ciliary nerves, which come out of the ciliary ganglion. The short ciliary nerves carry parasympathetic, sympathetic, and sensory fibers between the eyeball and the ciliary ganglion. They target the ciliary muscles, sphincter pupillae, dilated pupillae, orbital and tarsal muscles, as well as blood vessels of the eyeball. The second branch from the nasociliary branch are the long ciliary nerves. They carry general sensation from the eye and cornea. The nasociliary nerve continues to give off the posterior ethmoidal nerve, which supplies general sensation from the mucosa of the posterior ethmoidal air cells and sphenoid sinus. The next branch it gives off is the anterior ethmoidal nerve, which provides sensation, general sensation from the mucosa of the anterior and middle ethmoidal air cells. It has further branches, but we won't go into those into detail. The final branch it gives off is this, the infratrochlear nerve, which conveys general sensation from the skin of the medial eyelids, bridge of the nose, the medial conjunctiva, and superficial structures of the lacrimal apparatus along the medial orbit. These include the lacrimal sac and the superior and inferior lacrimal papillae and puncta. Next, we'll go through the maxillary nerve. Here, the maxillary nerve has 5 main branches. Before it exits the skull, it gives off the meningeal branch, which supplies general sensation from the dura of the middle cranial fossa. The maxillary nerve exits the skull through foramen rotundum. Here. It then enters the pterygopalatine fossa, which is just here. It then gives off 5 main branches. This is the first branch, the zygomatic nerve, which gives off 2 branches and works to supply the skin of the anterior inferior temple, the zygomatic bone and arch, and the upper cheek. This occurs by the zygomaticofacial nerve, which runs along this part of the face, and the zygomaticotemporal nerve, which runs over the temporal bone. The zygomatic nerve enters the orbit via the inferior orbital foramen. It then exits the orbit through the zygomaticofacial and zygomaticotemporal foramen, seen here and here. The next branch of the maxillary nerve is this, the infraorbital nerve. This is the extension of the maxillary nerve and works to supply the teeth primarily. It gives off multiple branches. The palpable branches of the infraorbital nerve, which supplies a general sensation from the skin and conjunctiva of the lower eyelid and exits through the infraorbital foramen. The infraorbital foramen is where it exits the face. Gives off this branch, which is the palpable branch of the infraorbital nerve. It then gives off 2 branches. The nasal branch of the infraorbital nerve, which breaks off into external nasal branches and internal nasal branches, and superior labial branches. Before it exits the face, it gives off 2 branches. The middle superior alveolar nerve, which is only present in 30 to 80% of people. This one. It supplies the premolars, occasionally the first mesiobuccal root of the maxillary first molar, and the premolars. If this is absent, sensation is via this nerve, the anterior superior alveolar nerve, which supplies the pulps of all the anterior maxillary teeth. And if the MSA is absent, then it also supplies the premolars and the first mesiobuccal root, MB1, of the maxillary 6. These are extensions of the nerve, known as the superior dental plexus. The maxillary nerve also gives branches to this ganglion, the pterygopalatine ganglion. This is a very major ganglion and it is very involved with the facial nerve as well. It gives off branches. Firstly, the greater palatine nerve, which provides sensation to the hard palate in the mouth. And the lesser palatine nerves, which provide sensation to the soft palate of the mouth. This ganglion also gives branches forwards, including the nasopalatine nerve, which provides sensation to the incisive papilla here, at the roof of the mouth, in between the first two incisors. It also provides the pharyngeal nerve, which carries sensory and parasympathetic fibers. The sensory fibers convey general sensation from the mucosa of the nasopharynx, whereas the parasympathetic fibers innervate the small mucosal glands of the same territory. The final branch of the maxillary nerve is the posterior superior alveolar nerve, which supplies the posterior roots, the pulps of the posterior teeth. It emerges here and supplies the pulps of the posterior teeth, with exception to the MB1 of the 6. Finally, we will go through the mandibular division. The mandibular division exits the skull through the foramen ovale, here, along with the lesser petrosal nerve from the glossopharyngeal nerve, which is important when speaking about the innervation to the parotid gland, which we'll speak about later. After it exits the skull through foramen ovale, one branch, turns around and re-enters the skull through foramen spinosum, here, and this is known as the meningeal branch. It enters the foramen spinosum with the middle meningeal artery. It supplies the meninges of the anterior cranial fossa and the dura. After exiting at the foramen ovale, the mandibular nerve gives off a few branches before dividing into anterior and posterior divisions. This is the anterior division. This is the posterior division. It gives off a few branches before doing so. One such example, if we can get to it, is this, the nerve to the medial pterygoid muscle. This is a motor nerve and provides innervation to the medial pterygoid muscle, which is one of the muscles of mastication. This nerve also innervates the tensor tympani and tensor verdi palatini muscles. Motor innervation. The nerve then splits off into anterior and posterior divisions. The posterior division is primarily sensation and gives off 3 branches. The anterior division is primarily motor and gives off 4 branches. We'll go through the posterior division first. The posterior division has 3 branches. This first one is the auriculotemporal nerve, which provides sensation from the ear, external acoustic meatus, tympanic membrane, temporomandibular joint, and skin over the parotid gland and posterior temple. It also provides parasympathetic innervation of the parotid gland. It does this via hitchhiking fibers from the glossopharyngeal nerve. The glossopharyngeal nerve becomes the tympanic nerve, which then becomes the lesser petrosal nerve. This is within the skull. The lesser petrosal nerve, as mentioned earlier, exits the skull through foramen ovale with CNV3. Immediately after this is the otic ganglion, which lies immediately below the foramen ovale. Parasympathetic fibers from the otic ganglion through the glossopharyngeal nerve hitchhike along the auriculotemporal nerve here and work to innervate parasympathetically the parotid gland, which lies here. This also has branches and splits off and terminates over the temporal region, the temporal bone, providing sensation over this area. Of note, the auriculotemporal nerve has this feature. What passes through here is known as the middle meningeal artery, which enters with this branch, the meningeal branch, enters the skull through foramen spinosum. So the middle meningeal artery pierces auriculotemporal nerve and enters foramen spinosum with the meningeal branch of the mandibular nerve. Going back to the posterior division, we have the auriculotemporal nerve, and then we have 2 nerves that are important for dentistry. We have the inferior alveolar nerve and the lingual nerve. The inferior alveolar nerve is otherwise known as the dental nerve, innervates all of the pulps and teeth of the mandibular arch. As you can see, it enters the mandibular canal here at the lingula, enters in, and supplies sensation to all of the pulps of the mandibular teeth. Before it splits off, it innervates the pulps of the posterior teeth. It then splits off here, just before the mental foramen, here. This branch is the incisive branch. It continues forward and provides sensation to the pulps of the anterior teeth. The other branch, this is the mental nerve, which exits through the mental foramen and provides sensation to the lower lip and associated mucosa. These are its terminal branches, inferior labial branches and gingival branches of the mental nerve. This provides the gums, this provides the lips. Of note, the inferior alveolar nerve also gives off a nerve before it enters the mandibular canal. This is a motor nerve. Before it enters the mandibular canal, it gives off this branch, the nerve to the mylohyoid muscle, which is located at the floor of the mouth, here. This is the mylohyoid line. and is one of the attachment sites of the mylohyoid muscle. This branch also terminates and gives another branch to the anterior belly of digastric, which is also motor. The final branch of the posterior division is the lingual nerve. The lingual nerve provides sensation to the tongue, general sensation to the tongue. However, the chorda tympani nerve here comes from the internal acoustic meatus, from the facial nerve, and provides special sensation to the tongue, specifically the anterior two-thirds. So to summarize, the chorda tympani provides special sensation to the anterior two-thirds of the tongue, hitchhikes along the lingual nerve, which already provides general sensation to the anterior two-thirds of the tongue. These are terminal branches of the lingual nerve. But essentially, they innervate the tongue. This is also a branch of the lingual nerve and goes to the sublingual ganglion and the sublingual gland, salivary gland. That's the posterior division. Now we'll go through the anterior division. The anterior division of the mandibular nerve is primarily motor with the exception of the long buccal nerve, here known as the buccal nerve. We'll first go through the masseteric nerve. The masseteric nerve provides motor innervation to the masseter. It runs over the mandibular notch here and provides the masseter, which is located here. This nerve is the posterior deep temporal nerve, which provides motor innervation to the temporalis muscle. This nerve provides motor innervation to the lateral pterygoid muscle, which is located here. This, along with this nerve, both provide motor innervation to the temporalis muscle, anterior and posterior, deep temporal nerves. Finally, this is the buccal nerve, or the long buccal nerve, which provides sensation. This is the only sensation of the anterior division. Provides sensation to the mandibular arch for the posterior teeth, to the gum and associated gingiva. And that is all for the trigeminal nerve. Thank you for listening.